Welcome students, welcome to my channel. This time we will look for the norma basalis, the view from the base of the skull. The view from the base of the skull is called norma basalis. If you're looking from the lateral aspect, this is called norma lateralis. From the front, it is called norma frontalis. From superior direction, it is called the norma verticalis, and from posterior, the last one, it is called norma occipitalis. For now, we have to look for norma basalis. Norma basalis is divided into three segments by two transverse lines, anterior transverse line and posterior transverse lines. Anterior transverse lines passes along the posterior free margin of hard palate. This is palate, hard palate, and this is the posterior free margin of hard palate. So this is the anterior transverse line, and foramen magnum, the anterior margin of the foramen magnum, a line through the anterior margin is the posterior transverse line. So this whole norma basalis is divided into three parts, 1, 2 and 3, respectively called as the anterior side or the anterior part, middle and the posterior segment of the norma basalis by two transverse lines, anterior transverse line and posterior transverse line here. Coming on to the features of anterior part of norma basalis, the anterior part, most of the anterior part is formed by the alveolar processes and the hard palate. This is the hard palate and this is alveolar processes of maxilla. The alveolar processes of the maxilla of both sides forms an U-shaped arch. This is called the alveolar arch. Coming on to the hard palate, this is the hard palate formed by two bones. One is this one is the palatine process of maxilla, and this is again the same palatine process of maxilla. In the midline, they got fused together, forming a suture called intermaxillary suture. The posterior part of the hard palate is formed by the horizontal plate of palatine bone. This is the horizontal plane of palatine bone, and they also form a suture between the two. This suture is called the this suture here. This suture is called the interpalatine suture. Together, this whole line, this whole suture and this suture here, it is the suture between your maxilla and the palatine bone. So this is called palato-maxillary suture. It forms a cross sign here, and it is very important question for the VIVA. If we trace this suture right here on the posterior side, it forms a spine-like structure. This is called posterior nasal spine, and on the anterior side, it forms here. This is called incisive fossa. And from the posterior nasal spine, if we go to the lateral side, we can see the U-shaped crest. This is called palatine crest, and where we have the ending of palatine crest, we can see two foramens, this one and the smaller one, this. These are the here again on the other side, this bigger one. So these two foramens are greater palatine foramens, and this is the lesser palatine foramen. From the greater and the lesser palatine foramens, greater and lesser palatine nerves and vessels are passing from here. So this is the part 1 of norma basalis. Stay tuned for part 2. Thank you for listening.